Good morning. It's snowing day. Going to work here in the cold. Today we're gonna discuss about feeding patients. There's a lot of things to consider. So I hope that you can find this helpful and put it into use for your daily routine as far as feeding patients. Yeah, getting some hydrations. Get myself ready in the middle of the shift already. So when you feed patients, you have to think about those situations, whether it doesn't matter how old they are. So there's good reasons why patients has to be fed. One is they have dysphagia. They can't swallow. They have difficulty swallow, okay? They might choke, and those patients are on pureed, just like small bites. So they can't have a hamburger, or they can't have a piece of chicken breast. Yeah, those has to be pureed. Another reason is the paraplegic. They can't use their extremities. They can't use their hands, right? But they usually the ones that can swallow, they have no problem swallowing. So I prefer that because you don't have to worry about them choking, and then you don't have to worry about the speed. Not that you're gonna rush them through the meal, of course, but they can eat at the speed of a normal speed, like you and I would. Okay. And another reason is blind people, blind patients. They can't see where the food is. They can't see where the drink is. They're gonna knock the drink over while trying to reach for the food, right? So that is another reason why they need to be fed. I know that our schedule is tight, and we're probably one of the other aides on the floor, or sometimes you're alone on the floor, and you have to feed 2 or 3 patients for a breakfast, lunch, and dinner for a day shift, of course, because day shift I don't know, I worked night shift before, but I feel like there's more to do on day shift. And then there's more interruptions as well. Such as when you're gonna do vitals, but PTOT is in the room, and then you have to move on. You only have so much time to finish all of your 16 or 20 patients, and you only have your window, you only have so much time to get it done because the nurses are passing the medications, right? Especially blood pressure medicines. Anyway, off track. Go back to the feeding. Like the blind patients, they don't know where they're reaching for, right? Unless they don't have, most of the time they don't have difficulty swallow. So I usually, if they have a banana, I peel it, halfway, and I have them hold it. Of course, their hands are working, they just can't see. So eat that at their own pace while I try to feed them with the other food. With that being said, you can alternate food. I'm the type of person that likes to take a bite of here, a bite of there, even transition in between dessert and the meals, like the meat or the potatoes or things like that. You need to alternate because sick people, they don't have that appetite anymore. So if you're gonna finish feeding them with a whole chicken, then when they're done with that, you will start with the mashed potatoes. Then when they're done with that, you're gonna start with the dessert. I mean, they're not gonna do that. They're gonna take a couple bites of this, and they say they're done. Okay, so that's why you need to do, a bite of mashed potatoes, right? A bite of chicken, maybe a bite of the grape, okay? Not bite. Give them the grape. you know, a bite of the sherbet or ice cream, whatever they have on there, right? So you don't bore them. You don't like kind of, you kind of enhance the taste a little bit for the patients so they don't quit, they don't give up easy, because nutrition is really important for the healing, right? For the dysphagia patients, you can't rush it. You can't rush. I know that you are busy and you have to move on, but what are you gonna risk them choking? For the staff to help you out, your coworkers to help you out with call lights and some other duties that you may have to attend to while you stuck in the room feeding a patient, you text the group. That way the charge nurse and your coworkers, the other PCAs know that you're gonna be feeding a patient. So you're gonna be in there for a minute. That way, also your boss won't think that you're ignoring your call lights. But you can't rush. You can't rush the patients. Risk the chance of them being choked or being an aspirate. Okay, if they have coffee, if they have water, milk, things like that, you alternate the drinks as well. Kind of have to develop a method to help them to, the sick people, like I said, the sick people, they don't have no motivation, no appetite to eat at all. So your job is not only to feed the patient and get it over with, but it's to motivate and provide nutrition that they needed. Okay, that's it. Thank you for watching. Have a good day. Take good care of yourself and your patients. Yeah, make sure you have yourself some snacks and swallow some waters. Okay?